Hello, everybody, and welcome to the HRN show. Your host, Alex Grichuhin. I'm the Director for Advanced Lung and Heart Disease with HRN. I mentioned my first name and, of course, my title, but we also are going to have a cardiologist that is going to be doing some of the HRN lives. So just stay tuned for that, as that's coming up rather shortly. Anyways, we have a few topics today. If you haven't done so, if you could subscribe on our YouTube, Instagram, and Twitter, and of course Facebook. If you haven't done so, just to follow us on those pages, as we're showing a lot of great content, and we'll be showing a lot of introductory videos on different pieces of equipment and so on and so forth.
And you can find the links to those in the description.
That's right. If you have any comments along the way, please don't hesitate to write in the comment section of this, and especially during our live views. As you know, our HRN shows are on Tuesdays and Thursdays at around 11 o'clock this time, of course. So if you haven't done so, please like and subscribe on those. Now, we brought up a clinical. I want to bring up a clinical instructions, as there was a bunch of clinical people, pulmonology and specific, that incorporate. That means from nurses, respiratory therapists, pulmonologists, things like that. So they're asking for an introductory, introductions to the Delta V, and there's a hospital down in D.C. that there is, for those that don't know, there is no pulmonary rehabs in Washington, D.C. So there is zero. And GWMC, George Washington Medical Center, they said, we need these Delta Vs in as soon as possible. So I'm sending them this. But I had a lot of questions on clinical instructions. So I want to just point out something on the clinical instructions really quick. So the Delta V mouthpiece, a primary respiratory muscle trainer used in pulmonary rehabilitation centers across the globe. This is not just in the United States. We send them out to other parts of the world too. The Delta V was developed in 2017 by both a respiratory therapist and pulmonologist working in pulmonary rehabilitation. The majority of respiratory muscle trainers found in the world do not have a flow management system, as respiratory therapists and pulmonologists know to be vital in proper respiratory muscle growth achievements, since it's the speed of inhalation and exhalation that makes the resistive setting accurate. For example, if you pull an empty syringe plunger too quickly, the resistance is very high. But if you pull the same syringe plunger slowly, the resistance is very low. With a flow management system in place, your patient will know if he or she is breathing in through the device too fast or too slow. We found that patients that breathe too shallow have weak respiratory muscles, not allowing them to breathe deeper, resulting in low oxygen and high CO2 levels, which it causes an increased work of breathing. Excuse me. Proper respiratory muscle training is a major focus in pulmonary rehabilitation. By implementing proper respiratory muscle training to patients, you will see evidence in improved coughing capabilities, improved mucus clearing, improved oxygen levels, better exercise recovery, improved CO2 elimination, improved 6-minute walk test scores, improved oxygen titration, and of course neurological disease and more. Common users for the Delta Vs are usually people with COPD, pulmonary fibrosis, idiopathic pulmonary fibrosis for improving DLCO, improving someone's ability to simply cough, like someone with chronic congestion. The Delta V is designed for both inspiratory and expiratory respiratory muscles. The Delta V's unique design has many applications, making the Delta V the primary device for improving patient care. Now, this is the Delta V. Okay? It is a very simple device. It's a mouthpiece. It's called the Delta V mouthpiece, or we just call it the Delta V. The Delta V is a very unique device. You can attach it to an incentive spirometer using the flow management system found on the incentive spirometer. And does anybody remember where the flow management system is on an incentive spirometer? You can grab 2 incentive spirometers. Do you know where the flow management system is? Right here. Okay, it's just on the right. It's not that big chamber. It's the one managing the flow rate. Same thing over here. It's right here on the right side, or on my left, your right side. Okay, so when we attach the Delta V to an incentive spirometer, the clinician would see, and as well as the patient would see, if they're breathing in too fast or too slow. So if I have this at a very high setting, my goal here is not to get a high number, because I'm managing my flow rate, the speed of how fast I'm inhaling and exhaling. So if I can keep the flow meter ball to the top arrow, or the flow meter ball here, just between the sad and happy face, just above that top piece right there, if I can bring that flow meter ball there, then I am good. That's flow of how fast I'm inhaling or exhaling, okay, is accurate. Of course, incentive spirometers only you manage the flow rate system on inhalation, not exhalation. So if I have this at a high setting and I'm breathing in through it, and I can't bring that to the top arrow, then the setting is too high. If I have it really low and I breathe in, my goal is not to just try to keep it in there, is try to breathe in quick. Okay, so when I'm breathing in, and I can easily bring the flow meter ball all the way to the top, now I know a setting of 3 is obviously too low. So with a proper flow management system, it's pretty hard to miss. It's very easy to use, very easy to clean, but it's the most inexpensive device found on the market today, as most devices, respiratory muscle trainers out there, are either not clinically approved, they haven't had a lot of users that show clinical evidence of improvements. There's a lot of, basically, you can't really go wrong with the Delta V. We use it, a lot of hospitals, a lot of facilities use the Delta V, and there's a reason why. It's been proven to show improvements in people with respiratory complications, especially when we're trying to improve their oxygen, their CO2 elimination, muscle growth, everything. Okay. All right. So let's go towards the topics today. All right. So today on our live stream, what should I do if I experience increased coughing with blood or blood-streaked mucus during my rehab exercises? Topic 2 is, how can I build a support network to cope with the challenges of living with a chronic respiratory condition? Okay. And like I said, if you have any comments along the ways, questions, anything like that, that's fine with us. Just go ahead and write in the comment section, and we'll be happy to answer those during our live feeds. Okay. All right, John, do you have any input on anything yet?
Michelle says good morning.
Good morning, Michelle.
So, yeah, these are just questions that I wanted to have answered myself.
Of course, of course,
just
of course.
Out of pure curiosity. So,
yeah, of course.
If anybody has anything that they would like to ask, please feel free to put it into the comments section, and we'll make sure to answer it live.
Yes. Now, for what should I do if I experience increased coughing with blood and blood-streaked sputum or mucus during my rehab exercises? So, coughing, a good way of looking at this is that there is a lot of things that will happen during anybody who exercises without having lung disease. Okay. Anybody who exercises would usually get an increase in a little bit of congestion. Not severely. They'll have a little bit more, I would say, lubricant. Okay. When we run for a very long time, it is normal to sweat, right? When we exercise for a long time, it's perfectly normal for the heart rate to go up a little bit. It's perfectly normal for blood pressures to climb a little bit, as that's a cause and effect. And increased work of breathing during exercise. We know all this, right? But a lot of people don't know the increase in congestion. So that will happen because when you're breathing in fast, your body's trying to make sure there's enough mucus, around basically your airways to humidify the air coming in. Okay, so when we produce mucus, it's not necessarily a bad thing. Okay, it's just too much of it tends to wear us out a little bit because we're having a little bit of complications with too much. All right, when the body's trying to lavage, does anybody understand what I mean by lavage? When the body's trying to rinse out its system, it uses the fluid in it. That's why hydration is incredibly important when it comes to rehab, when it comes to rehabilitation, pulmonary rehabilitation at least, as well as cardiac or any other rehabilitation. Hydration is always important every day of life, of course. It's not just for pulmonary, but your body needs that water to kind of lubricate, to help, decrease surface area, to help, humidify. There's a lot of reasons too, of course. And it even tends to use some of it as fuel. So oxygen itself, we understand that when we breathe in oxygen, comes into our body, we breathe out CO2. But what we don't go in depth with is what happens. So let me take this really quick. All right, and the heart stays mediastinal, the center, mediastinal, to the pericardial cavities that are bilateral. So it's usually like this, but the lungs are actually, these lungs are very small compared to this heart. That's like almost an actual size heart, maybe a little bit smaller. But the lungs, normal lungs are actually this big. In comparison, proportion with the heart would be this big, a normal lungs. Okay, so this is like the size of maybe a 4-year-old's lungs. Okay, it's about pretty accurate actually. I would say about 4 or 5 years old. Okay, so we're exercising, and we haven't exercised for a long period of time, or I'm just starting up exercise. So what's going to happen here? The lungs are going to inflate and deflate, right? As I inhale and exhale. So inflate, deflate, inflate, deflate. If these weren't working for a long time, let's say I haven't exercised for a long time, I might produce a little bit of blood-tinged sputum because I'm stretching the lungs out. I'm moving them more often because I'm exercising. And sometimes that might produce a little bit of blood, okay? It is alarming. Without a doubt, it is extremely alarming because that doesn't usually happen. But when it does happen, if it's light tinged, very light tinged, like very light, not anything dark, very, very light, it usually resolves on its own. But that being said, don't take my word for that. If you see any blood-tinged sputum, you want to consult with your doctor, letting your doctor know, hey, it's just a little light blood-tinged sputum, because we see that from time to time, but it's nothing necessarily to be extremely alarmed about. It's just the body's moving and being used, and there might be a little bit of wear and tear that accumulates from it. So when I inhale and exhale, sometimes I might produce a little bit of blood-tinged sputum. So the first step you would ever do is you would have to report it. Make sure you report it to your doctor, and then your doctor will give you instructions on what to do next. In the meantime, while you're waiting for your doctor to answer, I would suggest making sure you stay well hydrated. Anytime if you see your oxygen is going low, if you feel discomfort, if your anxiety is too high, it might cause a lot more problems just from the anxiety level, and it might be a pretty good idea to actually go into the hospital. Okay? I'd rather you be safe than sorry. Okay, like I said, usually if we see that, it's usually mild, and that's why I use clinical people. You don't use a personal trainer to do pulmonary rehab. You don't go to a gym to go into pulmonary rehab. You use clinicians that are trained for this, okay? And that's why I approach it not for each and every person that has a little blood-tinged sputum. You might have, out of 10 people that have blood-tinged sputum, you might have one that's an emergent condition while you have 9 of them that are not. Everybody's a little different. So we treat everybody different, right? And we treat them the same with respect. I'm talking about the way we take care of them. We treat that differently, because not everybody has blood-tinged sputum. In our pulmonary rehab, we don't see it very often, but when it does happen, we do report it right away to the referring provider, but we make sure we keep a very close eye on it. We let the patient know to hydrate, make sure that person hydrates a lot. If they have any discomfort, anything at all, any mild angina, that's chest pain, any types of chest pain, anything like that, you want to go to the doctors right away, if not call 911. Okay.
Now, what could be causing that, essentially? Could it be
wear
something?
And tear. It's just wear and tear.
So it couldn't be something more...
No. I mean, that's the thing is, you don't know. You don't 100% know. It could be a simple wear and tear. It could be something that the person breathed in really quick, or they were just simply breathing, and there was a lot of scarring on one side that called a rip, a small rip in the lung parenchyma. And your lungs are very, very vascular. So if there's a little bit of a rip, it will bleed, but it should be very light. If there was a dark bleed, like you're seeing a lot of blood coming out, that is, of course, emergent. And you definitely want to get to the hospital or call 911 as soon as possible. It might not even be a good idea to get up and go to the hospital. It might be a good idea to have the ambulance come over to pick you up. Okay. Like I said, I'd rather you be safe than sorry. So the common occurrences are usually wear and tear. There are some times where somebody was very aggressive or they inhaled something that was a foreign body, and they brought it into their lungs, causing the debris or something kind of puncturing through, into the lung cavities itself and causing a little bleeding. So that is a chance, right? That's always a possibility, and we always want to just keep an eye on it as close as possible. But if you're in a hospital, the first thing we would do, we'll lavage you, keep a very close eye on you. Look at your blood pressures, look at your oxygen, look at your heart rate, everything. And we just monitor you. And usually it resolves itself, but it all depends. Like I said, everybody's a little different. It just depends on the circumstances.
Gotcha. So we have a question from YouTube.
Love it.
So this is from Disturbed South True Crime on YouTube. That's his YouTube channel. Or that's their YouTube channel.
Welcome.
So I know that might sound a little strange. That's not just a usual name.
Yeah.
Anyway, so he said, or they say, I have COPD and get infections quite a lot for which I am admitted a lot of times in the hospital.
Okay.
I am now on antibiotics every second of the day chronically. Is that good for my overall health?
No. When we use medications, a lot of times it's to splint the effect. It doesn't really resolve the problems per se. There are medications that save people's lives, don't get me wrong, but a lot of the medications that we use, like a doctor sometimes would give a certain medication to decrease wheezing and things like that, and those are necessary. But there is no medication to fix an obstruction. There is no medication to fix stiff lungs. Nothing like that exists. So we have to rely on an exercise and rehabilitation. Okay, and rehabilitation should always, no matter what, should always be done with a clinical supervised staff. And what I mean by that is, like, HRN is a clinical supervised staff that monitors the patient during rehabilitation. Even after the program, they still monitor those patients. We still monitor those patients. So when we're doing rehabilitation, we always want to make sure we incorporate that to each and every person. But for overall health, it's not, for all these medications, your body's basically, it's going through and I don't mean this in a bad way. I really don't mean this in a bad way. I'm not trying to trigger you, or something, but your lungs, your body, and your health is declining. I'm just going to point it out. It's declining. If we keep taking medications, we keep adding, all this other stuff, but we're not doing anything for our overall health. Like we're not exercising, we're not going for a walk, we're not trying to do breathing exercise, we're not doing any, then we just obviously, I'm using the word obviously, we're obviously getting worse, and it'll just keep getting worse. And if you're going back and forth to the hospital, well, that's very common with specific lung disease like COPD, because you're immunocompromised. So your immune system is compromised. And a lot of people, they'll try, let me add some garlic to my foods, let me do this. Again, your body's trying to attack all these infections, so all the immune support is going to those infections and not going to the other things that might be happening in your body, meaning you're immunocompromised. Okay, because your immune system's trying to attack this and that, and let's say you have kidney disease, you have an infection on your foot or something, or so on and so forth. You're immunocompromised. When you have a fever, you're immunocompromised. When you have a high temperature, you're immunocompromised. There's a lot of reasons to be immunocompromised. A lot of cancer patients, actually, I think most of them are immunocompromised. So they're more susceptible of getting sick than others because their immune system is well boosted because they don't have all these complications. So how we fix that is we have to exercise our lungs and start exercising our body, because just exercising your body, your immune system starts getting boosted up. You're causing your red blood cells to be circulating faster throughout the body. Think of it like this. Let's say in this small little space, which is going to be hard to see on this camera, but let's say in this small little bit of space, okay, you can hold, let's say 300 million cells, okay, in that small amount of space. And you have one small tear in that, okay? Each red blood cell, which is incredibly small, each red blood cell, just pretend it holds a very, very, very small Band-Aid. Okay, think of it like this. So it grabs the Band-Aid, let's say from the liver, okay, and let's say the infection is in your lungs or in your leg. Let's say the leg. All right, it has to travel because it can't take a whole big Band-Aid because it's too small. So it takes small pieces, what we call like these. We have cells in our body that repair tissue, So imagine these little red blood cells carrying these small little Band-Aids, really extremely small. But the surface area is 300 million. So, and let's just pretend that each red blood cell can carry a Band-Aid to cover only, let's say, one cell, but there's 300 million. So it has to travel all these Band-Aids, 300 million of them, to cover this small little area. If I increase the blood flow, then those Band-Aids on those, I know it's a weird way of saying it, but it's a fun way to kind of it's a fun way to describe it to somebody that might not understand how the body works. So if the blood is traveling really slow, it's going to seal up that tear, right? But it's going to take a little bit of time because it has to do 300 million rotations, and depending on how much red blood cells are in that little spot in your blood. So it has to grab all those Band-Aids to repair. Okay, and let's say that will take 6 days. If I speed up and I start exercising, the blood flow increases. So instead of 6 days, it might be only 3 days. Because remember, they're carrying this Band-Aid from one spot to another to repair that tissue. Okay? So what I'm saying is exercising repairs. It increases your immune system. It increases the repairing. I mean, there was a study done on it, and I know a lot of people don't really understand studies and the reasons for studies, but these are valid studies that we use to save people's lives. And there was a study that they took an ECMO machine. Well, not an ECMO. It was a type of ECMO machine. And what they did was they isolated a small spot in somebody's skin, and they just threw blood. They just threw blood circulating through it incredibly fast. The cells healed up almost like Wolverine does when he gets cut. The cells healed very rapidly.
Really?
But it was not possible for a human being to push that much red blood cells through that area that quickly. They demonstrated multiple times that if you increase the blood cells to rapidly go to that area, the chance of it being healed quicker are all the way up to the sky roof. So increasing vascularity helps promote healing, is what I'm trying to say. Okay, I was just trying to make it fun, playing on words and stuff like that, But does that make sense? Did I describe that pretty well? Did everyone understand that?
I think so. I think that explains it. It basically comes down to you don't want to.
Exercise fixes everything. It nearly cures everything.
You don't want to take away your body's ability to heal
Fight
itself.
its own infection, exactly. Instead of using and be dependent on these medications and things like that, which some of these medications are required. You need some of these medications. I'm not saying don't take medications, but what I'm saying is, exercise increases the effectiveness of whatever they're trying to do.
Yeah.
Okay. I mean, you exercise on a routine basis, you dramatically decrease stress. You dramatically, you decrease depression. You increase stamina. You increase agility, mental acuity, everything. Just exercising alone helps memory. I mean, just exercising alone helps somebody's brain. It's just incredible. So, yeah, you need to incorporate some exercise. Any questions on that?
Actually, we have 2 comments.
I love it.
Rita says she loves the way you explain things.
I know, Rita. I'm sorry. I did the best I could.
No. This is she's not being sarcastic. She's not being sarcastic. She's saying she loves the way you explain it. You're making it easier to understand.
Thank you. Thank you.
And Disturbed South True Crime says thanks for your answer. It makes 100% sense.
Okay.
He said, or they say they've started walking and lifting some light weights as well. He says, or they say greetings from South Africa. So.
Oh, thank you. Welcome.
What time is it over there?
It's the same time, I think. Same time zone, Eastern time, I think.
They're just a day ahead.
Yeah, I think it's it's just, I'm not 100% sure.
I don't know.
I've been thinking, answer it.
Yeah.
And they're right there. What time is it over there?
Yeah. What time is there?
That's how it works. It's actually on the same longitudinal line, so it should be the same time. Yeah, it should be the same exact time as it is over here, because they're all nearly on the same longitudinal line. So it should be the same.
I'm not sure. It says 5:28 p.m. So, glad you could tune in as you're coming home from work or as you're wrapping up work for the day. So about 5:30 is what they say.
Over South Africa?
Mm-hmm.
I gotta look at the lines again.
Anyway,
you know what's funny? Somebody said, "Hey, Alex, I want to live forever." Did you ever hear about this?
Mm-mm.
It's on the globe. So let's pretend this is the globe, a piece of a globe. Okay, the longitudinal lines, the big lines that come up from the north to the south end, right? If you move to the next longitudinal line, the time changes differently, right? It increases or decreases depending on which direction you're going. So, and that's why, like in Eastern time, Eastern Standard Time, we're at right now 11:29 a.m. While if you go to California, it's a 3-hour difference. So each time zone, it all depends on that longitudinal line. So what time is it in? So if all the times are different on the longitudinal line, what time is it on the North Pole?
there is no time.
Exactly. There is none. it's always 12 o'clock. It can be 12 o'clock at night, or it can be 12 o'clock in the day.
So the reason I know that is because actually on Instagram, some scientists posted that.
Did they?
Yeah, they all stood in a circle and they said it's 12 o'clock right here, no matter what.
Yeah, it's always 12 o'clock. He said, if you want to live forever, go up there. You'll never age. You will age, but you'll never age. I thought that was really interesting because there's no time up there. It's always 12, and it's for 12 hours, and it's always 12 for the other 12 hours.
Well, it's similar in Antarctica, isn't it? Like
I think it's pretty similar.
Their nights are like
it's
6 months and days are 6 months or something.
Yeah,
like
it's
that.
pretty similar.
I don't know.
It's pretty. I always think that's pretty neat.
Anyway. So we have some more questions that I want to get to. But Alex, before we do that, I have another question that I wanted you to answer.
Sure.
About the importance of support groups.
Okay. Let's take a person that lives by themselves. They don't have family that comes around very often, or they don't have family at all. Isolating that person starts to become hungry for attention and support, and just being able to be social, just being able to talk to somebody. And because that person probably is isolated for such a long time, it's actually causes a lot of mental effects for that individual, depending on each individual, because not everybody reacts the same way as someone else. Everybody's different. But anyways, so what support groups, the benefits of support groups, it takes the group or communication, to that person that it stays isolated. And then that person that was depressed, anxious, feeling alone is not feeling alone anymore. And depending on which support group you're in, it might also, on top of being beneficial as a way to communicate with other people, but depending on the support group you're in, let's take you have a COPD support group. Now you have people that you can talk to that are also now relatable to you. Might not be the exact everything you're going through, like same disease, but it will be this. You'll have a support group that you can communicate with, you can talk to. If you're feeling alone, and it's surprising too that Facebook and I'll use Facebook for this reason. At 2 or 3 o'clock in the morning or 12 o'clock, Facebook is still very, very, very active. So even if you wake up in the middle of the night, you still have, most likely have somebody you can still communicate with on Facebook, depending on the size of the support group. With our support group, it's very, very, very large. We have a very large support group. And so the chances of somebody being up in the middle of the night are very, very high. Versus you go with somebody who has a support group that has 100 people. There might not be a lot of support there. Because a lot of people that try to support or go into support groups, they'll attend on average maybe once a month. On an online support group, it's extremely more frequently, almost nearly every other day. But a physical support group is tougher. You have to physically drive there, things like that. These online support groups are fantastic. So the importance of support groups, you have camaraderie experience, you have people that are unique or kind of similar to you, your age group, to what your medications, to disease, to whatnot and have you. So it's being in a support group, I would say, should always be should be mandatory for each and every person, as I found a lot of family don't understand what the patient is going through. I find that very common. Did you ever notice, anybody want to have an input on this? Anybody viewing me right now, do you find that your family doesn't really understand what you're going through? Like they really just don't understand that, they're like, oh, come on, just go upstairs. I really can't. My work of breathing is too hard, it's too tough. I really, really can't, unless you join into the HRN, and of course we get you up those stairs. But a lot of family they don't understand, and even some friends don't understand.
Michelle says yes.
Yeah, but you take somebody who has the same, let's say, and let's leave age out of it, but you take somebody who has the same disease, they know what you're talking about. So they're more relatable. And it's not frustrating because you're trying to convince people that don't understand it of, my work of breathing is very high, I have a lot of problems walking, and they don't understand that. But you take somebody that is very relatable to, they can easily understand and maybe even give you an insight of what they do to help themselves out, especially when they struggle.
Pamela says, yes, they don't understand why it takes me longer.
Yeah. I see that very often in malls when malls were very popular. And you have a bunch of kids in front of the grandparent, let's say, and it's like, come on, Grandma, come on, Grandpa, we're going to miss the movie. And of course, the grandparent's going as fast as they can, but, and they feel so obligated to go quicker. But by going quicker, they might cause an injury, and then, of course, you might wind up in a hospital. And, so it's support groups, I feel, are extremely necessary and very important, especially when people are by themselves and they just don't understand what that person's going through. Now you have a group of people, 5,000 plus people on our support group that literally understands what's going on and how, what you can do to help. So,
Rita says she said you're good. You nailed it. COPD groups are a blessing.
Yeah. Yes, it is. It really is, and that was one thing is we developed the COPD group, and afterwards we initiated a pulmonary rehab program that people, if they are really bad, that they can utilize if they wanted to. And the HRN program is the Bentley of all programs. We try to get as many people in as possible because there's no wait time and it's all done virtually, and all of us that know about HRN know virtual is not inferior to face-to-face or brick-and-mortar facilities.
So I actually put a link to our support group in the comment section.
Beautiful.
So if anybody watching this is not a member there, just please feel free to, take a look at it. And, you can join.
A lot of videos, a lot of content.
We're the admins, so we'll get you in. There's tons of content that we post, that other COPD patients post, that they just, it's a community.
Yes.
In that sense. Pamela says, all groups I joined, I'll mention you, Alex, and HRN.
Oh, thank you very much. Thank you. The cardiologist coming in, I always butcher everyone's last name, but his first name is Evans. We'll just say Dr. Evans. High-ranking cardiologist. He's close to retirement, but he's been a cardiologist for over 30 years, let's say. But a very, very, very good cardiologist, and he's going to be working here full time. So he's going to be here full time and heading the cardiology department. So he will be starting. He's already started, but he's going to be starting in full time, I think, in beginning of November. So just stay tuned, because he's obviously going to be he wants to do some of the lives and questions and answers, because he likes the engagement with patients. And I always find a doctor that likes to talk to patients, not just say, hey, you got this, wait for my bill. That's it. So I shouldn't say that. But I hate to say that because it's partially true.
Well, it's not just doctors. It's multiple different professions.
They go in and they're literally just go into the emergency room, and they're like, hey, how's it going? And you're like, who is that guy? But you get a bill from that person. He's like, yeah, I did see the patient. Yeah, technically you did, but you didn't really talk to me.
Yeah, I mean, what is it?
It's only because I can relate to that.
Lawyers can charge for a 5-minute phone call, they always say.
Yeah.
It's
like when I got ran over by that bus several years ago at the Conference by the Sea. I got ran over by a bus, and all these lawyers jumped in. And as soon as they saw it was going to be work, they jumped off. It was just the most craziest thing. It was just incredible. I got hit by a bus, and but anyways, it was.
So I noticed because I'm watching the stream myself,
Yeah.
I noticed on there, there's plenty of likes and hearts coming in. Keep them coming, guys. Keep them coming. Likes, share, subscribe.
Oh no! Don't worry about the bus thing, because it was crazy. I forget what year it was. It was several years ago. I would say 3 years ago. But the bus that weighed about like several tons, like the city buses, the MTA buses, the rear of the bus, which holds the heaviest of the weight because the motor of a transportation bus is in the back, so the heaviest part of the bus is in the back, and the tires ran over my chest. But when I came out, and they have video of this. When I got up, I dusted myself off. All I had was a couple bruises, and everybody thought, "How in the heck are you still alive?" Ambulance took me. I went to the hospital, and they did an X-ray and everything. They says it's not. We don't understand. We see the track mark on your chest. We see the video. You getting ran over, but how do you not have one broken bone? Is beyond me. I said, I think somebody up there still loves me. I said, that's why, because I can't even explain that, and I remember the whole darn thing. I can't explain it, but yeah, that literally happened.
Oh my gosh, Alex. Oh my gosh.
Yeah.
Anyway,
Crazy.
yeah, I hope you played the lottery that night. Anyway, so as we go on to our next question,
Can't break steel.
You're still on the bus.
I had to say it. Can't break steel.
Oh my gosh. All right. So, Karen from Facebook, she asks, what happens when you have large red blood cells? Do they still work the same?
So, let's take...
I've also never heard of that term, so maybe explain that as well.
Yeah, it might not be the right way to describe it, but you can have a lot of red blood cells, but not large red blood cells. But if somebody, let's just say, for argument's sake, that somebody did have one red blood cell that's a lot larger than the others, then of course when it goes through veins and capillaries, it would get clogged. The veins and capillaries would get clogged and cause tissue death right away. Kind of like sickle cell anemia. Sickle cell anemia, they create it like a sickle cell, and the chances of embolisms and clots and everything like that are extremely high because of the denature of the shape of the red blood cells, and that happens. That happens with a lot of people who suffer from sickle cell anemia. Anemia, it sounds like low blood. That's not true. Anemia has to do with blood.
Gotcha. So, Carol from Facebook asks, do you think it would be okay for a person with pulmonary fibrosis to do walking laps in an indoor chlorinated pool? I wonder how the smell would get to them.
I'm wondering if that would be an issue, because sometimes you have some people that are very sensitive with smells, and that might be an issue. But let's take that out of the equation, because if that was part of the equation and you couldn't tolerate those smells, then obviously that wouldn't be a good place to work out because it's constantly affecting you. Kind of like diving. I'm a master diver, and you only go into the water with the proper, thickness on your wetsuit or dry suit, but mostly the wetsuits, because dry suits are a lot easier. But anyways, you go into the water, and depending on which thickness, depending on the water temperature, the visibility, but you go in and you want to be as comfortable as possible, when you're diving. Okay? And what I mean by that is, let's say you go into a pool and you don't feel comfortable at all, then no matter what exercise you're going to do, your mind is focused on trying to make that uncomfortable feeling of whatever it is comfortable, or trying to tolerate it. And that's not a way to do it. Like when I was diving really deep, very deep, the pressure of the mask was affecting my sinuses, and it was hurting me, and I couldn't concentrate. Everything else was fine, but I had a hard time concentrating on, on the task at hand. And because there was a little discomfort because all that pressure of my mask, water pressure pushes, it created a lot of problems as far as comfort, and I didn't enjoy that dive, So, but let's take the fumes out of the equation for a second. You have pulmonary fibrosis. You're going into the water, so that's going to be beneficial if you're doing deeper breaths. If I compress into the water and my lung muscles aren't very strong because all that fibrosis is creating so much weight and stiffness in my lungs that it makes it harder to breathe because my lungs are not very compliant. They're having a hard time being stretched because they're so dense. Then the water pressure is going to add that to it, sometimes resulting in even a shallower breath than that, because now you have water pressure and but as long as you're trying to breathe in deeper with that pressure, you will actually increase respiratory muscle growth, but you would have to try to breathe in deeper. So I would say there's a benefit to that, of course. Plus you're in water, it's not doing a lot on your joints, which is great. It's great on workout. I love swimming. So I see there's incredible benefits, but there are some things that you want to keep an eye out on, is making sure your inhalation is deep enough where you're seeing some chest rise, you're breathing, you're not struggling to breathe, and the chest tightness is not too severe. Because if it is too severe, you might have to go to a shallower spot of the pool. Okay, I hope that helps.
I think that does. I mean,
That's
think
a great question.
Yeah, I think the issue with a lot of indoor pools, though, is that they over-chlorinate them.
Yeah, they do. There are some pools that use salt, and I found that to be a lot better. But some people, they have a hard time with it, and I don't blame them. Just so some fumes and chlorine is not a great fumes, to really breathe in. It's not the greatest of all smells.
Actually, that's why Disney, they don't use chlorine in their water. They use bromine. Because it's
less of the...
It cleans it more and is less than the smell is less for the water. So for the guest satisfaction on that front. But the problem is bromine is more expensive, which is why everybody uses chlorine.
Gotcha.
So not related, or somewhat related.
No, it's a good insight. It's a great insight. Because then if somebody has the pool, they have a hot tub, or they have something that they want to chlorinate, they can use something that's not going to be so aggressive. Mm-hmm. So there are options out there. Are there extra cost? It looks like it.
Yeah.
But maybe the cost outweighs the benefits and vice versa.
It's like with everything else.
Yeah, that's just the way it is.
Yeah. So Diane has a question of her family is she doesn't feel like her family understands why there are certain foods she can't eat. They say yes, you can eat it, but they don't understand the carbs affect her.
That's a really good question. How would you confront your family? And I would say the best thing to do is education. You're a human being, okay? And as a human being, it's our job, in a sense, to educate ourselves on something that might be relatable or interesting. And let's say at the dinner table, you have your family, and during that, you told them, I want everyone to eat, but I want everyone, and your family will be, I'm sure, would be agreeable on this. I just want to spare 5 minutes to talk to you about this one little subject that's only going to take 5 minutes. And then you just bring up just simple education that you can read off to them, explaining the effects, and make sure it's through a medical journal. Make sure it's through an actual source that's reputable, not a place like Wikipedia or something. Okay? Or because some family will see that and be like, well, how do I know that person's correct? Well, that person's a doctor. So, well, how do I know that doctor's correct? because that person's a doctor, and they're giving this, and plus that person is high ranking. They've done this. They can see that, and hopefully they would be a little bit more understanding that fact is an actual, of course, fact, because it's a proven fact for clinicals. So just educating. It's a really good question because we get that from time to time. But educating everybody at the dinner table, just letting them know what carbs do. And then, what the craziest thing is that after you say that, most likely some family member will talk about something they ate, and kind of, if they're agreeable, even a little bit, they'll try to bring up a subject that they can relate to. Like, yeah, I remember when I was eating this, I had a lot of salt, I felt really thirsty, and stuff like that. And he's like, yeah, and then they can kind of understand. If you get a family to understand just a little bit, they're on your side with that, versus a family that's like, oh, you don't know what you're talking about. Okay, I might not know what I'm talking about, but that doctor does, or that practitioner does, or this, because, and I try to stay away. No, I don't try. I do it. I stay away from negativity, always, because I want that in my life. I want negativity in my life, so I stay away from negative people, and I want, I need my brain. I need my brain to function, and I'm saving people's lives. I'm doing a lot of work for people, for myself, for my health, for my family, and I would need to make sure my mental health is just as good as my physical health. So if you're around people that just don't understand you, then you definitely want to have a one-on-one conversation with that person.
Diane says thank you.
You're very welcome.
And so does Carol for answering the previous question.
And if you guys want to, why don't you invite me for dinner and I can explain it to them.
Oh my gosh.
Yeah. I don't do meatloaf. Sorry. No, I'm joking.
Yeah, you aren't the only one in this room right now. I can't do it either. Catherine from Facebook, she says that my family knows if I'm in a bad way, but she never talks about it. How can she? So that leads into my question of how can somebody feel comfortable talking and expressing how they feel regarding their COPD to either their family or a professional, etc.
It's a great question. Who is this person?
Catherine from Facebook.
Catherine from Facebook. Well, Catherine, welcome. It's a very tough subject because you're hoping that this will be the only time you'll have this conversation. But let's be very realistic here. There are a lot of times where family that might not, they understand it, but they don't understand, and it might have to take 3-4 times to explain the same thing for them to kind of understand it. And so one talk might not be enough. Sometimes you're hoping one conversation is all you need, but there are some times where it's a little difficult. In a support group, like in a physical support group, we try to find somebody that can relate. So let's take somebody in your family that really, I don't want this to make it sound like there are people in your family that are bad people. I don't want to make it sound this way, but you want to find a family member that usually has your back most of the time. That is supportive, I should say. That is supportive. Okay, and it's let's say it's your son, your grandkid, or whoever, just somebody who is supportive. Okay, and talking to that person that's supportive. We should all have somebody that might not be the greatest supporter, but does support and does have your back at times. And it'd be great to have somebody that really has your back versus another way that really supports you. So you would approach that person, like instead of talking to all 6 people at once, find somebody in your group or even a friend that can come with you and just invite that person maybe for a lunch or breakfast or a dinner or just a simple family meeting. I have family meetings every week with my family. I talk to my son, and I know this is a little different, but I talk to my son and say, all right, Has anybody bullied you? How are you doing in school? Have you been cleaning up your room? And how are what are you doing with your chores? And what types of things do you want to do this week? What types of things should we be working on? What types of things that aggravated you? We do that every week, my family and I, and it's extremely helpful because now I'm really communicating with my son that has a hard time communicating, but we all can understand what's going on with that person. It's almost like an intervention in a sense. So you would want to find somebody who's very supportive and talk to that person how you want to address this certain topic that you think your family or your family doesn't really understand it fully. And you want to have somebody with you. Let's say that was not the case, then unfortunately you were going to have to bring it up in front of everybody. You could start with one person or you could do it with everybody, but usually in a dinner meeting, I use dinner a lot. And the reason why I use dinner meetings a lot is because the person's about to go to bed. The person will also think about what just happened that night. Usually. And it doesn't have to be an award system, but talking to those family members and just talking to one at first or in a group, it's beneficial to have somebody else that has your back, that other parents or other people that are around you, other family members that are around you, can kind of also understand you, especially if they feel that, okay, you always talk like you have the short end of the stick while this person is pretty healthy, and this person that's very healthy, that's your family, has your back and is also talking about this. Then that family will be more in tune because now they have two sides of the story instead of just one. And they're just bringing up simple education. It's a very tough topic, but there's different ways to approach it. If you have somebody that has that basically comforts you a lot and talks to you a lot, I don't want to say use that family, but talk to that family member saying that, hey, I want to talk to my family about my problem. And I understand they know my problem, but I want to kind of address something that won't take a lot of time. Be sincere, be positive, but be sincere, and make sure that this part of my life, it frustrates me and I'm having a difficult time. And I want my family to understand what I'm going through, so when they see something that in the future, they'll understand that, okay, one of my family members might have a hard time in going up this escalator or going up these stairs or doing something, because their mobility differences. So it's one of the best advices I can give you is really sitting down with one family member if possible, but if needed, the group, and just say this is mandatory. This is mandatory. Even if you live with them or they come over to visit, make it mandatory. And why not everybody? You can, if you wanted to, start your own little support group, if you wanted to, with just your family on Facebook. So if one family member is in California or one's in Arizona, one's in New York, you can still keep in communication through Facebook and posting things like your recovery, your struggles, things like that. And your family will see that you're actually trying to help yourself instead of just talking about the problems.
So Catherine brings up honestly a good point in terms of a branch of what we were just discussing.
Sure.
In the sense, she says my daughter does understand does understand everything for her respiratory health because she's a respiratory therapist. But
wonderful.
She lives 800 miles away. But she doesn't want to get her depressed, even though she knows the road that she'll be on. How do you overcome that feeling of, I guess, either burdening or where you need to know that you have your needs too?
So it's a common misconception that you feel that the other person will get depressed by you explaining what you're going through because that's how you feel. That might not be how that person feels. That person that went into the field of respiratory care, for instance, knows the fact that they're going to be handling patients that are depressed. They're going to be handling patients that have a lot of complications. and they're fully well aware and trained of how to handle those types of patients, versus somebody that has no knowledge nor the patience to do it. But you're addressing a situation that you want, let's say, expertise from a family member that studied respiratory care. I think you will find that person won't be depressed. But if I have one of my family, like my mother, one of my family members approached me, that never approached me as a child for advice, but approaches me now to help her out. My mother was one of them. And from every person she talked to, she only wanted to talk to me. Not because I was just her son, but because I actually fixed her health a little bit. And it might be a little bit of a different situation, but not necessarily. I found that when my mother did that, I had a different feeling or a different level of respect that I felt. Now my mother respects me as a clinician. Though my mother told me she was afraid to tell me, but it made me feel happy that she wanted to ask me a question about some disease. You will find that maybe your daughter or maybe the healthcare provider that's one of the family members or anybody that is kind of in the field that would actually feel honored to actually be, for you to actually confront somebody in a professional field. It's honorable. That person's not. I would never get depressed if my mom told me that. I would say, okay, let's go ahead and fix it. I said, okay, I will understand, because now my family's looking at me as this. When do you understand what I'm saying? Don't be afraid to talk. That's a common misconception, that I feel that because I'm depressed, I'm going to share my depression with somebody else, and the other person's going to be depressed. That's not the case.
And Catherine brings up a good point.
That's a great point.
In addition to that, where she feels like, but she's mom. So in other words, she has to be strong and be the
You've
rock.
always been mom, and you will always be mom. You're the mom. You're the tough as nails.
You have to put yourself first.
You made your kids live and learn and everything. It's, but it doesn't also mean that I have to mention to my mom that sometimes I'm a human being. I'm not a machine. And she doesn't like when I say that, but she understands when I say that. I said, I'm a human being, and it's like I said, it's a sensitive subject in a way, but I think you really just need to talk to your daughter. You will find that your daughter or your family member that kind of can relate to it in a sense, especially educationally, will be very, very grateful that you're talking to her about it. And you will see that that person will actually reach out to you more. Not saying that your daughter doesn't. I'm just saying in general that the outlook of what your daughter is helping a mother, her mother, that is tough as nails, always does everything and does everything the best she can. And now is asking. You have to think of it that way. You have a warrior of a person asking you for help or discussion or talk. I would be honored if somebody that was a lot higher, that achieved a lot more, asking me for advice. I am honored. For somebody so like that. You can't look at it that way. You have to understand that that's, the reason why the person turned out to be so great, because they had a great mom, and great job, mom, on that. Okay, but there are times where the nails sometimes have to be pulled a little bit or straightened out. You can be tough as nails, but you just have to understand that it's okay to be vulnerable sometimes. We are still human, even though we feel like we're invincible. Okay? Remember, Superman can always bleed. All right? But Superman is what? Not brave, because he's indestructible. Right? But so it's hard to be brave if you're indestructible, because you know that you're always going to live. But don't worry about that too much. Right? It's just definitely talk to you will find a great level of respect coming back for asking those questions to somebody. So, again, great question. Very sensitive topic, but great question.
She says thank you.
You're very welcome.
So we're coming close on that time. So, Alex, do you have any final thoughts? Anything you would like to share?
I don't have necessarily anything that's extremely, that I like to necessarily share. We are working with a lot of doctors and everything in pulmonary, and everything is looking great on our end, but the access or the information about about pulmonary rehab, just in general, the awareness is what I'm saying, is what I'm talking about, is not out there as much. And if there's any way that you guys can share some of our videos to your own page or your own, your own support group or something, it will help us out, but also help the viewer out. Especially when you're really taking your health seriously, and you're being preventative, you're getting educated on how to do this and that, and but yeah, if you can try to share any of our content to other people, or even just explaining to your doctor maybe about pulmonary rehab, and hey, I found this really great pulmonary rehab, or things like that. Things like that. It will benefit not just you or the doctor, but those other people that can't breathe. I always feel there's always somebody that that can't breathe well.
So, to caveat off of what Alex is saying, give us a like, give us a follow, and share our content, so that way we help out more people, so that we can increase our reach, so that we can reach out to them in a sense. Let's work together to build a community here. Just wanted to remind everyone, on October the 3rd, so that is 2 Tuesdays from now, we will be hosting our Ask the Expert series. Dr. Shaw will be hosting that at 6:30 p.m. He will be joined by Dr. Eugene Shostak, where they are going to be discussing COPD and lung valves.
These are two very high-end doctors, so I would really suggest watching that, especially during the live.
Absolutely.
I would really suggest that.
So you'll be able to watch that on our YouTube, on our Facebook, on our Twitter, or on our X, formerly known as Twitter account. I know,
there's so many of them.
That's just a whole different mess. Anyway, point is, you'll be able to watch it live on October the 3rd at 6:30. So yeah, definitely tune in then. Alex, do you have anything else?
No, but my wife showed me that my puppy misses me.
Oh,
that's it.
All right, well, that's all we got today. Thank you guys so much for watching, and have a good weekend, everyone.